Hey guys, welcome to Canada. I just wanted to check in here real fast. It's day one in Vancouver, and we're in between sessions, and I just have to show you this view real fast. The International Parkinson's and Movement Disorder Congress is in Vancouver, starting today, and it'll be going for the next 4 days. We just finished our first two workshops, the very first workshop, but 3 speakers at the conference, and I have a little bit of motor fluctuation tidbits to share with you all. But before I do that, I want to show you the view here that I'm looking at. It is a beautiful, beautiful scene from Vancouver. Look at that plane on the lake. So cute and majestic, and I love Canada and Vancouver. So to all you Canadians, what a wonderful place to be. Okay. So I wanted to check in here real fast. I took some notes, and our first workshop had 3 speakers, like I mentioned. We talked a lot about motor fluctuations in Parkinson's, so things like dyskinesia, dystonia, which I'm going to be talking about more in depth as we go along this week. But the first speaker I wanted to talk with you guys about was, his name's Jean-Christophe Corriveau. And he talked about the prevention, treatment, and management of motor fluctuations and dyskinesia. So, he was talking about how 90% of Parkinson's patients have motor complications after 10 years. And over time, most patients are very likely to have more time spent in the off stage. So your off stage is when your Parkinson's symptoms worsen because your Parkinson's medications are wearing off. And there are a lot of different presentations of wearing off, but the goal of taking your Parkinson's medications is to keep you in this optimal zone where you get enough to overcome some of your symptoms so you can function but not over-medicate you to the point where you have some dyskinesia, which dyskinesia just means abnormal movements, and that can come in a variety of ways, which I'm going to talk about more at a little bit later time, the types of dyskinesia and where they may be coming from. But what I wanted to hit right now is a lot of you have been talking about Parkinson's medications and how do you prevent some of the side effects. A lot of you are scared to take Parkinson's medications and you're not taking them, or you're just not increasing your medications for fear that you'll get some of these movement fluctuations, and that's a fair fear. And so what we talked about was how to manage the early motor fluctuations in Parkinson's, how to manage them once they become more severe, and then how to decide between these different therapies. So a lot of you have asked that question, like, how do I decide what to take or what to do? Should it be Parkinson's medication? Should it be deep brain stimulation? Should I be taking these supplements? And so I wanted to just kind of walk you through what was suggested today by this speaker. I'm sorry if it's a little bit wobbly. I'm trying to hold my camera still. So there are 4 management options that they touched on today for early motor fluctuations. So motor fluctuations just being this fluctuation of your movements and your symptoms. So there is taking the approach of the l-dopa, just adjusting your medication so that you're spending more time in your optimal state, which, again, you're not in your optimal state if you're having a lot of time in your off periods, or you're having a lot of dyskinesia. You're probably not optimally medicated, so that's something to talk with your physician about, your movement disorder specialist. Taking dopamine agonists, which we'll talk about a little bit longer, but that can be something that can be helpful for early motor fluctuations. And then there are Mao-B inhibitors and Comt inhibitors. And we talked about those a little bit. And as far as dopamine agonists are concerned, they're favored in younger patients to reduce things like dyskinesia and motor fluctuations. But you have a higher risk to develop somnolence and sleep attacks, and those things kind of can degrade your quality of life. And so the Mao-B inhibitors and the Comt medications, those are big words and abbreviations in the medical community, but those are types of medications that you can take. Sorry, I lost my place in my notes here. those are some of the things that are being researched, but they haven't had a big impact as far as the studies are concerned for long-term effects for motor fluctuations. So the takeaway that I got from that was there is a study out there that I'm going to post in the comment section below that you can maybe walk through with your physician that helps you understand, based off of what your symptoms are, if these different approaches will work for you. And it's like if you're having dyskinesia, you can look at this chart and it'll give you a plus or a minus as to tell you, okay, if you have this symptom and you're considering this specific intervention like an Mao-B inhibitor or a Comt inhibitor, then it has been shown to be effective or it hasn't been. And so I'm going to post that in the comment section below, just a link to that PDF, and the Table 6 is on page 9, so you guys can look at it and you can see, okay, if these are my main symptoms, will this be beneficial will these different approaches be beneficial for me? So you can take that to your physician and talk with them about it one-on-one, because again, I'm just the messenger and I can't help you make those decisions if I'm not on your healthcare team. So again, so those 4 management options of early motor fluctuations are adjusting your levodopa, taking a dopamine agonist, potentially taking an Mao-B inhibitor, and taking a Comt inhibitor. So those are for early motor fluctuations. Then he touched on, once you kind of go through that phase and maybe those effects or improvements are starting to wear off for you, depending on where you are in your journey, you may consider things like deep brain stimulation, Apo Morphine, the intestinal infusions of levodopa. Those are 3 options that are kind of considered later in the stage, later along down the line, because the risks are a little bit higher and the impact is a little bit more great. So if you're getting DBS, that's a brain surgery. So typically people don't consider brain surgery right out the bat. Apo Morphine is an injection, and so that's a little bit more intrusive than just taking an oral medication often. And then the intestinal gel, a lot of you have asked me about, is something that you can get implanted in your intestines to deliver levodopa right into your gut, because only about 10% of your Parkinson's medications, when taken orally, are actually delivered to your brain, is something we learned today. So as far as severe motor fluctuations are concerned, when you take the DBS approach, oftentimes with the right placement of your DBS, you can improve things like dyskinesia by significantly, and improve your on time by around 3 hours is what some of the studies are showing. So if you have severe motor fluctuations and you're considering DBS, that might be effective for you. The other option is the apomorphine, is a medication that I've heard a few times. I don't have a lot of patients who are taking the apomorphine injections, but essentially it's an injection or a subcutaneous pump that you can explore. And again, I'm just giving you the options. You can talk with these to your physician about them, see if they're correct for you. But the third one was that intestinal gel, and the medical term is intrajejunal, which just means inside your jejunum, which is in your intestine. So there is a pump that can put levodopa medication directly into your stomach and hopefully increase the absorption. And that has been shown to reduce off time by around 2 hours, but that's mostly for advanced Parkinson's disease. So again, there are a lot of options here, and what I'm going to do once I hop off here is put this decision-making matrix into the comment section below. It's a study that was done by Odin, O-D-I-N, don't know his first name, starts with a P, and it's just a collective, I guess, of different studies to help you and your physician decide on what approach is right for you. So the decision-making matrix is on page 9 of the PDF that I'll post below. So hopefully that can give you guys some guidance to go back to your healthcare team and be informed, but also know that it's important to talk to everyone on your team and then go with what feels best for you. So I'm about to hop into another session here, and I'll be back a little bit later with more information on dyskinesia and some other fun things. So I see some people checking in. Danny from Minnesota. What's up, Danny? Russ, of course, always stopping by. Thanks, Sarah. Enjoy the conference. I will. I'm just going to close with another view of this. Hi, Sally. I saw you in there. I'm going to close with another view of the ocean. I learned this is the ocean. Kathleen Smith, look for Emily. Yeah, I'm going to look for her. We're supposed to meet up, I think, on Tuesday. She was at the Power Conference. Hope you guys had fun, Kathleen and Wyman. All right, that's Vancouver. You guys, I'll see you very soon. Okay, bye. Oh, and if you have questions, post them in the comment section below. I'll try to do my best to answer them. Okay, bye.